Okay, what we're going to do today is we're going to follow the characterization guide that's in the manual that comes with the Optiglaze. It's just a practice guide. It's not, you wouldn't want to do every tooth that you do with this guide, but just showing you, this really highlights a lot of the characterizations that we can do with this glazing kit. So for this exercise, I've got a model here. We're going to do tooth number 9. I've sandblasted this so it's nice and clean. And so the first thing that we're going to do is I'm going to go with the Optiglaze Clear. I always shake it. The clear doesn't really necessarily need to be shaken, but I will do it anyway. The pigmented colors definitely do. So I'm just going to put 1 drop of clear, and I'm going to take my brush. Now, if you want to have 2 brushes, which I do here, I'm going to take the flat brush like this and just dip the edge in it here, the edge of the brush in the clear glaze. And now I'm just going to paint a nice coat of the clear glaze, just a very thin coat all over the surface of the tooth. And we have it nice and thin, completely covered. And then we'll take the Velo light, that's the curing light I'm using, and we'll cure that. Okay, so now you can see the glossy surface of the tooth. To clean our brushes, we just use an alcohol soaked gauze, and I just wipe off the brush like this. We won't need this brush again. So if you follow the guide, the way that I've set this up is that so we can make the most efficient use of our colors. Okay, so the first thing that we're going to do, and I did this in a sequence so that we could best use our stains efficiently. So in other words, if we're going to use an ivory white by itself, I'm doing that first, and then if we're going to add to that ivory white, I can add the drops that we need of another color. That way we're making most efficient use of our product. So I'm going to shake the ivory white up. The first thing we're going to do is we're going to make the white bands, the horizontal bands in the cervical third, and then in the cervical part of the middle third, and then the incisal part of the middle third. So I'm going to just put 1 drop of ivory white right there. Now, a mistake a lot of doctors and assistants make is they use way too much material. So you can just see I'm just barely putting the tip of my brush in, and we're going to make a horizontal white line at the cervical third. I've got those on there. Now I'm going to cure. Okay, so the next thing that we're going to do is pink orange. So I'm going to wipe off my brush, and we're going to shake up the pink orange, and we're just going to use pink orange just by itself. And you see where that is. It's just a little area in the cervical, in the incisal part of the cervical third, or the more incisally located part of the cervical third. So right in here, we're just going to make a little zone of pink orange right here. And that's that. So we'll cure that. Okay, so the next thing we want to do is, I've got my pink orange out. Now we're going to do the cervical, the most cervical part. So we're going to add 1 drop of olive to the pink orange. See, if we'd have done that first, then I would have to use another drop of pink orange for the when I was doing just only the pink orange. So we're going to mix this up really good. Okay. I'm going to wipe my brush off, get it nice and clean. And now we're going to paint the cervical, the most extreme cervical part of the tooth. Again, just barely wetting the end of my brush. For those of you that are more artistic and love to create things, especially if you're a painter, you're going to love this. You're going to love doing this. It allows you to give maximum creativity. So let's cure that. Okay, that was our pink, orange, and olive 1-to-1 at the cervical third. Now we're going to take pink, orange, and ivory. So I'm going to take another drop of pink, orange, and I'm going to put it here. One drop. And then one drop of ivory. Ivory white. No, yeah, it's ivory white. I'm going to put the drop of ivory white along with the pink orange. In the manual it says ivory, but it's ivory white. I'm going to mix that up really good. And then clean my brush off. Now with the pink, orange, and ivory white, I'm sorry, there's supposed to be 4 drops of ivory white, so I put 1, 2, 3, 4. Okay, that's what it's supposed to be, because we want it more white than we do orange, but just a little pink tint to it. Okay, this now we're going to make our mamelons. So a central incisor usually has 3 lobes and 3 mamelons. So we're going to take our 4-to-1 mixture of ivory white and 1 drop, 4 of that to 1 drop of pink orange, and we are going to then make our mamelons. We're going to make one here. We're going to put one right in here, and we're going to put a third one right over here near the distal, just like that. And we'll cure. Okay, so we've got that done now. I'm going to wipe my brush off, and now we're going to do an ivory white 3 drops to 1 drop of pink orange. And we're going with that, we're going to create a little craze line. So 1, 2, 3 ivory whites. One pink orange right there. I'm going to mix that up really good with my brush. Now you can do this with a brush, our little craze line, or what I like to do is take this is a size 08 endodontic file, and I'm just going to dip that in there, and we're going to create a little craze line right up through starting about the incisal, right at the incisal, and we're just going to take it up. While we're at it, let's just go ahead and do another one right over here. Okay, So just to show you, if you wanted to do it with your brush, you just do it a little bit with your brush tip, just a tiny bit, and we'll put this one like right here in the middle. Okay, so let's cure that. Okay, that was ivory white, 3 drops, pink orange, 1 drop. Now we're going to use our gray translucent. So here we have the gray. Now with the gray is pretty rich color. So I like to dilute it. So I'm going to put 2 drops of clear in with my gray. Now the guide just shows gray only, but I like to dilute it with a little clear. Okay, so I'll clean my brush off. And now what we're going to do is we're going to take the gray and we're just going to outline the mamelons with gray, where we put the mamelons earlier. So a little here, a little bit in here, and a little bit over here where we put the mamelons. And we're starting to see that really highlights the mamelons and makes them look really, helps them stand out better. Gives it a very natural look. And we might want to even go with a little bit more because it's diluted. We'll just put another little coat on there. So the mamelons were the ivory 4 and pink orange 1, and they're solid, and then we're just outlining them with the gray. And then we're just going to put a little bit of more gray just in here. Okay, let's cure that. Okay, now you see on the shade guide there's that orange just by itself. We're not going to do anything with that. I've done that and it just looks hideous, and I don't think you would ever put that in anyone's tooth, so we're not going to do that one. The last thing we're going to do is create an incisal halo effect. So we have, we're going to use regular orange this time, not pink orange, and we're going to put 1 drop of orange right there, and 5 drops of the ivory white. All right, we'll mix that up, make sure my brush is clean, got all the gray off of it. I'll put a little, freshen this up with alcohol here. Okay, I'm going to mix that up. Okay, so this is ivory white, 5 drops to 1 drop of orange. And what we're going to do is we're going to take our brush tip and we're just going to go right along the incisal edge. And this is creating our incisal edge halo. So if this were a composite, you would do all of this before you put your final enamel layer on. And then once you polish that enamel layer, all of this wonderful characterizations would show through, and it would be there forever. It won't wear away because you've got it coated over. If you're doing it for a temporary crown, you don't need to do that. You're just going to do it right onto the tooth itself, onto the provisional itself, and cure it. And it will last. I've had patients come back 3 months later, you know, something will happen and they'll have to delay their appointment, and they'll come back 3 months later and their crowns look fine. The stain is still all on there. And so if you want, then once you've got all this done, you can go back with a clear. It's not really necessary. I like to do it. And just glaze over everything one more time with clear. And you know, if you really plan this out, you could already have all your drops out and put a little cover on the lid. However, the beauty of this is that you're doing it on the fly. You're trying to match a tooth, so you won't normally know what colors you would need out before the patient gets there. And I'm using a lot of shades here. You can do something much more simple if you want. For instance, while we're here, I'll show you. We'll just go to number 7 right next to it. We'll take a little clear. We'll paint clear on here. A little clear right there. Cure it. Then we'll take a little of our cervical. And we'll just paint a little cervical coloration in there. Just like that. And then we can just go with gray only, with the gray that was mixed with some clear. And we can just come down here and do some kind of, if we had already done mamelons with our pink orange, we just go in and do the outline with the gray, like this. It'll still give us a nice effect. And then if we want to put a little white in there, a little white craze line or something, we can just use our, I'll just do a couple of horizontals here. There. And as timing would have it, we have mowers outside. So there we go. Can you, if I held that in closer, can you kind of zoom in on it? Or